Good morning.
Good morning.
We're going to give it just a couple minutes, see if other people show up. So
I don't know if you can hear me. Do I have to be muted?
Yeah, you could go ahead and mute yourself. That would be fine. And just so you know, and you don't have to turn on your camera. This will be recorded for later use. So just want to let you know that. But if you do have any questions, you can put them in the chat. And then if I don't have the answers, then we can actually put them to the side and answer them later if we don't have them. And we'll wait just a little, like probably a couple more minutes. Good morning. Oh, I think it's still connecting. Okay, we'll give it, again, we're just gonna give it a few more minutes. And this is being recorded, so you can turn off your cameras. You guys don't have to have them on. I'll keep mine on so that you can feel connected to me, hopefully. It's always nice to see a face until we can start seeing each other face to face in real life.
You can probably go ahead and get started, Natalie.
Okay. All right, so we'll go ahead and get started. Thank you for joining us this morning. My name is Natalie Pena. I'm not sure if you guys have attended some of my other presentations, but I work for Constellation, and I work with the People Experiencing Poverty Project, our initiative.
You what now?
Sorry. If you'd like to mute, please. Thank you, appreciate it. Okay, so I work with the New Mexico Department of Health, the Tobacco Use Prevention and Control Program, and I've been working in tobacco prevention for, I want to say 6 years, something like that, 5 to 6 years, maybe longer. I guess I'm losing count or track of the time I'm working with tobacco prevention. But one of the initiatives I'm working on, again, is with people experiencing poverty, and part of the initiative is really supporting community health workers on how to provide resources or what resources are available when they're working out in the community with individuals. So we're really wanting to provide even more CEUs. And at the end, I'm going to give you some other options of ways you can get involved if you choose to. But what we want to talk about today is New Mexico's nicotine addiction treatment services and resources. So in the presentation, we're going to go over some statistics in New Mexico, how it's impacting New Mexico, and then resources available. There are other places where you can get CEUs as well through the Department of Health, and it's online training as well. So we're really trying to provide all of the training that we have available, and so that you understand kind of what's going on with tobacco and nicotine addiction and the resources available. So this is a presentation that was created and developed by the New Mexico Department of Health Tobacco Use Prevention and Control Program. So basically their mission is to improve lives by eliminating the harm from tobacco use and nicotine addiction. They use the anti-oppression model framework, and that's something that we do as contractors. We typically will go through anti-oppression training just to make sure that we're getting the voice of all individuals who are impacted by nicotine and tobacco use. And also, again, for the effective strategies, we recently, TUPAC recently adopted the Reach, Involve, and Mobilize that came from the CDC, which is a model that allows the community to be involved in all interactions when it comes to tobacco treatment and prevention. This is something that we take to heart within the People Experiencing Poverty initiative. And when we start to implement our strategies, we actually use the Reach, Involve, and Mobilize model. And so they do it for individuals, organizations, and communities. And again, to develop policies, systems, and environmental norms that support nicotine-free lives. So really, we have the evolution of the People Experiencing Poverty Project has evolved from this particular model of Reach, Involve, and Mobilize. And we will continue to use that model along with the anti-oppression framework to support. And so the community health workers, again, are very important to us, and this is why we're reaching out. We also want to make sure that from the anti-oppression framework that we're offering some incentive, and part of that is providing CEUs to the community health workers, or even anybody who's taking this that might be able to get CEUs. We're open to actually getting CEUs for you as well. So we're going to go into the impact of tobacco, and this is so about tobacco and quitting. So tobacco and vape products contain addictive drugs and nicotine. So there's a lot of stuff going around with the vape products and e-cigarettes, and people have a lot of questions. Now, the research, again, we don't have research that tells us what the long-term impacts are going to be from vape and e-cigarettes. But we do know that it is addictive and that there's nicotine in this e-cigarette juice, and nicotine is a toxin. So the e-cigarette nicotine delivery systems, are part of some of the concerns that are arising in the health spectrum. So because I want to do this real quick. I'm sorry about that. So people's bodies and brains become addicted to nicotine. And we know that these products do have nicotine in them. And in fact, it's kind of interesting because we talk about cigarette smoking, but when we talk about vaping and e-cigarettes, we don't really know how much concentration of nicotine is in the systems. There have been studies done where they've looked at it, and it can vary. Also, with the nicotine delivery system, the individual user that's using it doesn't really know how much they're administering, and they can change it and control it. So sometimes they're getting more nicotine in that delivery system than they would an actual cigarette. So there's also withdrawal symptoms, and vape products are not safe or alternative for smoking. So what's kind of common within when we talk about tobacco use and nicotine use is that, people will say, well, I'm not a smoker. And that's a common theme across. And they'll say, I vape or I do e-cigarettes. So I don't smoke. And that's because of the vapor that comes off of it rather than the smoke. But again, we're not really knowing how much is being administered. And there's not the control over it is the juice can be concentrated at a higher level, and they're not 100% sure how much the individual is actually getting. And sometimes it could be a whole pack in just one hit, which is kind of interesting. So it's not an alternative, but the mindset around it is that it's helping people to kind of wing off their tobacco. Again, chewing tobacco is not a safe alternative. And quitting is a long-term process. So another common theme across tobacco and quitting is that people tend to say, I've tried to quit 3, 4, 5 times. They say it can take up to 6 times for an individual to actually quit smoking, and sometimes more than that, because they call it a 2-pronged process. So one process is the addiction, which actually is easier to overcome than the habit. And the habit itself takes longer to replace the habit, basically. So we tell people never stop quitting. And it can also be very, very, very hard to quit for an individual. So when I'm working with individuals who are wanting to quit or are having issues around it, I relate it to coffee. And I think that this is the best thing for me to relate it to. And if you're working with an individual out in the community who's trying to quit, in order to have some of the compassion or bring yourself into a space where you can relate to the individual, is thinking, what are the products that I use that if it was taken away from me would be hard to quit? And so coffee for me is one. And I think most people can relate to coffee because I believe most people drink coffee in the morning. It's a ritual. It's something that we've done for a long time. So it's like saying you can't have coffee anymore. Now, there is a difference, obviously, because when people do smoke, the second and third hand smoke is an offshoot and can impact other individuals around them, where, of course, coffee doesn't. But when we think about the quitting part of it, it's hard. It's not easy. There's the habit becomes harder to break than the addiction at times. So it's something that we and then giving the alternative of saying, well, go to the vape product. It's not really a safe alternative because they might be getting higher concentrations of nicotine, as I stated before. So again, the nicotine is the addictive state. And so we're trying to say, let's see if we can support people to wean off nicotine products altogether rather than just say, let's quit smoking and let's, move to something different that has nicotine in it itself. And we do know that as soon as you stop smoking, the quality of life increases. With respiratory, with heart, things start to heal, the lungs, and all of the other health benefits that come with quitting. And there's other health impacts also with people who do actually smoke, diabetes and other complications. So if someone's diabetic, amputations increase if they're a smoker. So if they usually doctors will say, quit smoking if you're a diabetic because your life will improve. You don't want to add on to the health issues that are already there. So we try to help. And we know in the health setting as well that before you can even have major surgery, your doctor will ask you to quit smoking as well. So the quality of life starts to increase as well. People can and do quit. It does take a long time, especially if they, let's say, smoke a pack a day. But there are people who actually have been successful at quitting. But again, it's a challenge, and we're starting to see even the behavioral health field, as I'm working in that field as well, that it's the last thing that people quit. And sometimes it's not even addressed. And because it's become normalized sort of as, well, I've done everything else, but what about this? But then it's the number one killer in all of the drugs. And so for us, it's how do we start to support those individuals, because we know that people can and do quit. So we're going to go into statistics about that. So there is an economic impact for individual, for the economy. And if you can see here, there's an economic burden in New Mexico is 1.4 billion a year. And that's just a huge number. I was kind of going over the slides yesterday again, and I was like, God, 1.4 billion. Like, I don't even, and that's not just, we're not saying that that's over like 10 years, that's in 1 year. So think about how that's adding up over, New Mexico. And this is the economic burden of people who are sick. And we talk about Medicaid costs and all of the burden that New Mexico has to carry when someone is a smoker. And so the annual cost for Medicare costs caused by smoking, as you can see, the number is 222,000. And again, that's annually. So that's part of the cost. Now, for as far as the retail package of cigarettes, it's $6.62, and we collect $2 in taxes. Part of the work that we do, we the New Mexico Ally Council on Tobacco, they are the ones who are heading up the policy piece of this. And taxes is one of the ways. There's a three-pronged process to help people quit, is to raise tobacco taxes. So tobacco taxes is one way that people stop smoking, and we know that it works. So as the prices of cigarettes go up, it becomes a burden on their wallet, and then they start to say, well, I either need to eat food or I'm going to get cigarettes. And typically people will say, God, I'm spending so much money, on smoking, and I can save this much money. And so they quit. And in fact, I have my own personal story of an individual who quit smoking because of this very reason. And as I was doing the work on increasing taxes, he he was upset. He's like, why are you working on that? Stop it," because he wanted to continue smoking. It was an addiction. It was hard for him to quit. He had tried in the past, and eventually he was thankful. And it's because of the tobacco tax increase. So that is another way that individuals can get involved. And we do know that it works. So um, each pack of cigarettes costs the people of New Mexico 16 in smoking attributed medical and lost productivity costs. So a lot of the costs that we're putting into the economic burden is days sick. So people will take days off of work. It also can impact the family with children. So secondhand smoke itself, if children are exposed to secondhand smoke, they can be out of school, they can get earaches, asthma can kick in, and then parents might have to have their kid out of school, but also they themselves could be having issues, respiratory issues themselves, or other, diabetes. Like I said, there's a bunch of different medical heart disease, diabetes, and lung cancer. So there's just a list of costs, right, for people, and lost productivity. Also, another thing that kind of goes into this, and something we're working with, is we're working with employers, and employers, when individuals at work take more breaks. So we kind of know that people that are smokers, they tend to get more breaks, and we're like, well, why do they get more breaks? And so they're smoking, and so there's lost productivity also in work. So a pack a day. So a pack a day smoker spends on average of 198 per month on cigarettes. And so we're looking at 2,400 per year. This is really important. I think when you're working with families, and if you're working with individuals that do smoke, and they come to you, and maybe there's some financial burdens on them, or they're not sure where they can save, that could be a point of conversation, to have them think about it. Not necessarily say, you should quit smoking. More of, well, let's look at how you're spending your money. And I'm not sure if that's things that you address with these families as community health workers, but if it's something that does come up, or if you do financial literacy for families, this is a really important point to talk about, because they'll start looking at like, what can you do with that money rather than spend it on cigarettes, and how can you start to minimize your usage, and perhaps if you're smoking a pack a day, start to maybe do 3-4 cigarettes a day, or to start to wean down the amount that you're smoking so that you can save money. And I believe that there are worksheets. That's something that I'll look into, that help an individual track that kind of information. So financial literacy is really important. And I think once people start to recognize that they're spending more than they could possibly imagine on smoking, they tend to say, oh, okay, well, I could have redirected those funds into something like paying my car off, paying rent, there's going on vacation, or whatever they want to do with that money. Or I've seen people also that have actually saved a piggy bank and then use that money for themselves, or see how much that they can save right? And really that becomes more of a visual for them rather than talking about it, but actually seeing how much that they can actually save if they wean down or quit smoking altogether. Give me just a moment with this. So the costs, let me just keep going here. Oops, go back. Okay. So tobacco is the leading preventable cause of death and disease in the United States. We say preventable because we have the means to prevent tobacco and nicotine usage in our youth. And I'm going to start there with this topic because when we look at the marketing of tobacco companies, their target our youth. And we, they, I should say, not we, sorry, they actually target them directly when it comes to, if you go to like a gas station and you see where they put the signage, you'll see that it's at eye level of a child, right? And so the tobacco companies, if they don't have you by the time you're about 19 or 18 smoking, you're probably not going to become a smoker. So if you haven't started smoking by 18, you're probably never going to be a smoker. Okay. And so for us, the prevention, in my mind, starts from the youth and educating them on smoking. And this happens when we're talking about second and third hand smoke from the parents, right? So if we worked with parents to let them know the impact of their children, and also if they smoke, their children also are impacted by it, they may become smokers as well. So we can prevent this, right? The cause of death, if we support the youth first. Secondly, when we talk about preventable cause of death and disease, right, is that it's a personal choice to smoke. We can actually work with individuals and let them know the impacts that it has on them. And this goes into other, so we have later on in the presentation, we have TUPAC has a bunch of presentations available that teach you how the impact of secondhand smoke is on other individuals as well. So not only are people dying from smoking, but secondhand smoke also impacts death rates as well when it comes to tobacco. Okay, tobacco kills more than 1 out of 3 people who use it as intended by its commercial manufacturers. So it is intended to kill. And in fact, if you look at a lot of these old packages of cigarettes, and even now there's a caution, it says will cause death or can cause death. So I get very passionate about this, and that's probably why I'm stumbling over the words, because it's really frustrating for me. This is me being honest, that it's okay for tobacco companies to put this disclaimer that it's going to kill, it can kill, but yet they continue to sell it to people. So they're really just selling poison to the individuals and saying, yes, it actually can kill you, and it's intended to kill. It's what it's intended to do. We know that nicotine kills. A story would be like this, and the concentration of nicotine. So a child ingested a vial like this of nicotine and died instantly. Couldn't reverse it. So for me, it's frustrating to see that they're able to just put this out here over and over and over again. And again, we're talking about commercial tobacco. So and then again, I talked about the marketing strategies. They spend over 25 million each day. Okay, think about that, 25 million each day to promote nicotine products in the United States. So we, as working in tobacco and nicotine prevention, are it's almost like we're behind the curve sometimes. They're ahead of us in a lot of ways, and we don't have the money to combat it, the way that they have the money to market it and manufacture it and give it to the youth and the individuals who they're enrolling into this market. So it's really, really challenging for us. I know that with the community health workers and the individuals that are working out with the people, that you guys have the trust of the community, and that's what's important here, that you guys can talk to them, because most people don't even realize that they're being targeted by the tobacco companies. They have no idea. They have zero idea that they're being targeted. And once they start to understand that this is, again, the oppression, right, that they're inflicting on them without even realizing it, sometimes their eyes open up because is it their fault that they started smoking? What really happened? Well, the tobacco companies came in, and I'm sure you guys can remember, most of you can remember when I'm sure that cigarette smoking was open to the public. Everybody did it. You could do it anywhere. It wasn't until the Clean Indoor Air Act was passed that you could smoke in restaurants. You could smoke at work. There was individuals smoking at work. Everybody was exposed to it. And they normalized it. It was a normal thing to do. And so everybody was impacted, and they were marketing it. And we even see the marketing ads from back then. We had doctors smoking. They said that they were prescribing it. I mean, all of these campaigns, well, they're still doing that. They're still marketing towards kids. And now it's become vape and e-cigarettes. And we'll see that on statistics coming up, how cigarette use is going down, but then now we have the vapes that are going up. So are we really making an impact? They still, hooked in the next generation of smokers. But people don't know this. So sometimes it's sitting with families and telling them, look, it's not your fault that you're a smoker. You've got to realize that they marketed to you. That's what they wanted. They made it seem glamorous. I kind of remember those with the slim cigarettes, I think they were the long for the women, and they were targeting women specifically, right? Slims or something. And they were, and it looked so, glamorous. And now, and even in movies, they weren't allowed to have cigarettes in movies, and now that lifted, and now we're starting to see cigarettes in movies again. I'm seeing it everywhere and instantaneously. That's how fast they do it. I'm like, wow, everybody's smoking on TV now again. And it's interesting. Characters that are cool, right? And they make it cool. So for me, it's educating the individuals that they were targeted. And because of that, now they're smoking and they realize that it's not so cool, right? We see the impacts later on of what it's done, and we're saying, no, this is not good. So vape and e-cigarettes, we don't know what the long-term impacts are, but I'm sure we're going to be telling a very different story about it, years to come. And then we have 2,800 New Mexicans die each year from smoking. When we start to look at this is more than suicide, homicide, all of these other drugs combined. When we put it together, more people are dying from smoking. And this is important, especially when it comes to the behavioral health piece of this, because the behavioral health it's usually the last thing that gets addressed with individuals. If they're going through hard times, you're like, well, let them smoke. It's the last thing they have. But the reality is that their chances of dying from smoking are higher than even doing heroin and all these other substances, alcohol. So it's something that we're trying to support people to really understand the importance and significance of addressing it, and working with individuals and educating them and letting them know. And then also coming to that compassion and understanding that it's not your fault. It's not your fault.
This Dr. Strickland has been around.
Sorry. Thank you. So, and it's not their fault. And so the compassion comes in to understand, how can we support you? If anything, if an individual doesn't want, and they have a child, how can we support your child, right? So that they're not exposed then. So for each New Mexican that dies each year from smoking, there are 84,000 others who will suffer at least one serious chronic illness caused by smoking. And there's a list of chronic illnesses. If you go online to 2PAC, there's tons of information on all the chronic illnesses. Again, diabetes, heart, lung, it really impacts all of your body. So we're going to go into tobacco use in New Mexico. As you can see, the numbers have sort of gone down throughout the years. And I don't know what it looks like now. I don't know if they have the data. I'm sure there is data, but I know I worked for American Lung for a long time. So they do a state of tobacco report I think it's every year. I can't remember if it's every, but you can go on there as well. And they kind of show the smoking rates for New Mexico if you're interested. So there might be some updated data on this as well, but you can see that it's actually decreased. So everybody's clapping, right? We're like, yay, it's decreasing. Oops, there we go. But then we start to, oh, hold on. Sorry about that. Okay. Oh, so this is the disparities first. So we're looking at, we typically, the unemployed are no diploma. So disparities, people in disparity tend to have higher smoking rates. And then if we look at all adults, right, it's lower. And so this is why people experiencing poverty is being looked at more importantly, because we want to understand how do we support the ones that are impacted the most. And, you know, why is it that they're impacted the most? And typically this comes down to the marketing again. And it's, if you start to look at the geographical locations of where they put these, where they put cigarettes or where they put gas stations, where they're flooded with ads, it's typically in neighborhoods, right, that are economically burdened. So they will do that. And then income, as you can see, if it's lower than 25K, they have higher rates. We do know statistically that more education leads to lower smoking rates. And I think it's probably also because they might have some education on the impacts of smoking as well. So that's why we're trying to educate individuals about what the impacts are, how the tobacco companies have really played a role, and how the oppression has been part of that. And that goes right back to the beginning of their mission and vision for Tupac. And so it's using the anti-oppression model really takes into account the fact that the marketing around this particular demographic, it's targeted specifically around them, which is oppression. And there's an issue there. So we're trying to figure out how do we support those individuals, and then how do we put first of all, their health back into their body, and then the money back into their pockets. So we were very excited about the decrease of tobacco use. And then we start to look at the youth, because we're thinking, well, then maybe the youth won't start smoking cigarettes. But then of course, they got really smart and they came out with e-cigarettes, which is really, when you look at it, and I'm just going to be honest from my own perspective, it's cool. It's kind of cool, right? You get this cool machine, you put in your juice. It's almost like a ritual, right? It's like this cool toy that you get to play with and put juice in, and there's big clouds of smoke that come out, right? And it's, the vape goes, I mean, that stuff really travels far and wide. I can tell you, I was driving one time down the road, and this kid had their window down with their vape, and it just came all in my car, and I could smell it, and they were like 2 cars in front of me. So, but then they could do circles. I mean, you could just go online and watch these videos. They actually will pay children to be influencers. So that's a big thing now in marketing, is being a social media influencer. So we have like TikTok, you guys know Instagram. Those are big things that they use, Snapchat. And so all of these platforms, these tobacco companies literally will pay the youth to use their products and promote them online. And so they'll show circles, and they're like, today I'm going to talk about this product and why I like it. And they shipped it to me today, and they're paying them to promote their products. So now we've opened up the door for a whole new arena of how to handle this stuff. And as we talked about earlier, we don't really know how much nicotine is being administered in each hit. They have done studies, and you could literally in one puff take a whole pack in, like I said before. So that's kind of crazy. So we're starting to see an increase in e-cigarettes becoming normalized, right? Also, when we look at the products that they're selling, it's like gummy bear and nerds and, all these, what is it? strawberry shortcake and all these really cool names, right? That children can relate to. Why? Because if they don't hook the children, they know that they won't become smokers. So their target literally is the youth, which is disturbing on so many levels. So now we're going to get into the resources for people who want to quit. They're free comprehensive services, and that's what I love. Of course, it's the Department of Health. So all the services are free, which is awesome. Okay. So again, we have the 1-800-QUIT NOW, the Hello Ya as well. And services are 24/7 in both English and Spanish, and on the phone or on the web. Here's the deal, and something that I just want to bring to your mind for those who work with the Spanish speaking community, and feedback I've heard from the community is that some people are kind of afraid to call in. They don't take any information from the individual. It's completely private. I would say that if you're working with a family, then they speak Spanish and they're afraid to call, that you maybe could call with them. I know that something that was asked, and I'm not sure if it will come out, but something that I've brought to the attention of the Department of Health is a video kind of showing what happens when they do call in Spanish, so that people kind of understand and they know that they're not, some people are afraid, well, I might get deported or whatever their concerns are, that they don't take any of that information. They're really just there to help individuals quit smoking. So if you are working with them, or if you need support on that, please contact me to let me know. And I think that's something that could be addressed with 2PAC as well. So the phone services, it's 24/7. There's a personal quit plan, which is really awesome. So each individual is different, and the way that they're going to handle their cessation support and quitting plan is going to be different. Some people have been smoking longer. Some people have tried more quit attempts. It just depends. So there's a quit plan for each individual. There's free self-help materials, unlimited sessions with a trained quit coach, which is really awesome. Sometimes people like that connection to an individual and a quit coach. There's free gum, patches, lozenges. I never see that one. Mail directly to the registered participant. So the only thing with this free gum and patches, they have to qualify for it. And I believe that there's a question. I'm not 100% sure. That's something, if you wanted to call, if you're working, you wanted to know this information, you can absolutely call the quit line, or you can ask us and we can find out what are the exact questions that are asked for them to qualify, because not everybody does qualify for the gum. I think they have to be smoking a certain amount of cigarettes per day in order to qualify for that. And that's because sometimes there's more nicotine in the gum than they're actually smoking per day. And they don't want to up the nicotine, or they don't want to up, they want to actually wean them off of it. So I think that if you called, or if that's a question you guys have, I can definitely find out from 2PAC what the exact, and I think it's a pack, 4 to 5 cigarettes a day, I think, but don't take my word for that. That's something that I'd have to get for you. Specialized specialized services for youth. Again, we deal with youth differently. Definitely don't believe that they'll be getting gum and all that stuff. So there's specialized services, and then also specialized services for pregnant women. This is something that's really important to me, is women who are pregnant. And perhaps if any of you work with, women or even women who have small babies, that there's services available. I think what is important here is educating them on the impact that it will have to the infant, and the impact it'll have on the individual. So there's services available for that as well. And that is online. So 2PAC, their website, if you haven't been there, they have a ton of resources, things you can print, but also we will be having an event coming up soon We'll be giving away packages to community health workers. You guys will be invited to come, and we'll have materials available. If it's materials that you need specifically, let us know and we can get it. So the materials are free, and we can get them for you. So again, we have online resources. So people don't have to call in. They can actually do the online resources as well, if that's something that they want to do. Again, there's pretty much the same information. There's a community forum if they want to chat with the community. We're also looking at, for us, looking at peer-to-peer, sort of integrating the peer-to-peer model. But again, they can do all of that stuff online. So again, if the Spanish speaking community is not feeling comfortable calling, they can actually go online as well. It's in Spanish. Internet-based activities that can integrate with phone support as well. So they can do both online services and call in, or they can just go online. And we're going to get into how to refer, because I know that we have all this beautiful information, but sometimes people say, well, just call the 1-800-QUIT now. And, the reality is they'll be like, yeah, okay. And they typically don't. So there's a process that I know you guys are aware of it because you've been working with communities for so long. And that's something that we'll go over in a minute. There's also text messaging support. So people that use their phone. So we're trying to get in every way we can, so they get up to 300 tailored to the participants' personal QUIT plan. Quick coaching call reminders. There's motivational and educational reminders. So they can sign up for that and get a reminder, every day, or something motivational that keeps them in the thought process of quitting. And then there's a la carte. Again, you can select from the options below. Again, it's free. I love how they have this little cart with the no money. It's free. And so that's what we want the community to understand, that it's something that we're providing, and we want them to know we're here for them, that there's this beautiful resource that's available, especially for people who've been trying to quit for so long and feel like they don't have anywhere to go, that we actually have people. And the coaching, I feel it's really powerful, because now you have an individual on the other end of the line talking to you, and you're not just by yourself going through it. So again, you get the 2-week starter kit. You get a quick guide, and then emails. So you can just select what you want. They can select what they want, not you, they. Okay, so training resources for health professionals. And this kind of gets into the stuff that you guys do. Here we go. So online training for health. So build your confidence. So we use the Ask, Advise, and Refer. And this is a really effective model. I know there's the 5 A's, but they've shortened it to Ask, Advise, and Refer. We have effects of tobacco on the body. So there's a lot of different ways that you can approach it. And it depends on what's happening with the individual that you might be working with. But still, if we understand how the reverse effects on the body happen, we can educate individuals on how to feel better, because a lot of people are dealing with chronic illness. And if we can reverse some of those effects, and some of them are triggered by tobacco, once we know, we can say, here's what's happening, and here's how we can reverse it. And again, it may not be all at once, but when they do their quit plan, it can just be like weaning off a little at a time, instead of a pack, maybe 4 a day, 3 a day, or whatever their plan calls for. So let's see, we also have fax referral instructions from pharmacotherapy, and cessation information. So the cessation information is really important. Again, that's the 1-800-QUIT. Now there's also so many other resources for cessation support. If, like, for instance, I work with a woman who works with people in apartment complexes, and a lot of people live in apartments, that will do one-on-one face-to-face coaching. It's part of their deliverables, and through 2PAC. And so there's that as well. But there's resources in order to support those individuals. And resources for advanced learning. So when we go, so the certificate of completion or the free CEUs that are online, if you go to tobacco, the Tobacco Use Prevention and Control Program, and if you go on their website, I'll pull it up after this. There's a place where they have all of the different training modules there, and you can go and I believe it's a couple of hours, and then at the end you'll get CEUs for it, and I believe it's 2 CEUs for taking that training. And that's something that I'm also going to be sending out. I'll send it out through the Office of Community Health Workers, Jamie, and ask her to send it out so that you guys have access to those training modules if you haven't already taken them. So the trainings will also go over the specific risks of tobacco use and benefits for quitting for families. Again, that's important. It talks about, the impacts of second and third hand smoke, effective communication techniques for addressing tobacco with women, minors, and families. So effective communication is really important, especially when we're speaking with a community, because it's not something we want to force on individuals. We're not trying to tell people they have to quit smoking. I think a lot of what maybe has stopped individuals from attempting to support individuals is that they don't want to feel like they're telling them what they have to do. And what I hear a lot, it's like, well, it's addressed if it's asked. But there are effective ways to engage in that communication and addressing it. And so it'll teach you ways and techniques to do that, and how to make referrals to the nicotine addiction treatment services and resources, which is good because you don't have to be the one who's the expert at supporting them through the process of it. That's already taken care of. It's just how do we refer the individuals to the resources in a powerful way and in a way that they want to go to the website, in a way that they want to be involved in it. And typically they say they want to quit and you say, well, okay, well, here's the 1-800 quit now, go ahead and call. So this gives you the opportunity to sort of understand what's available and how to refer to the resources so that they're feeling confident when they actually do go to get the resources and they're not feeling like it's too much or I don't know what to do or I'm just not going to do it. So the CHWs have a unique role. So community health workers for you specifically, they can provide brief intervention using the 5 A's, which I'm sure most of you have already know, but it's ask, right, advise, assess, assist, and arrange. So asking about tobacco use is a way to open up the dialogue. Do you smoke? Or have you smoked? Or even asking about it. So then advising, right? Advice to quit. And they go over all of this again and how to approach it when you take the training. And then the assess. I think this is the really important is what's their willingness to quit or make a quit attempt. I can tell you that I've worked with people who smoke and I can say this, I'm just making it I'll just say the majority of the individuals who actually smoke want to quit smoking. Rarely do you hear people say, I'm never going to quit. And there are times where people say, well, I'm never going to quit. And then you tell them about all of the health impacts, right? Or you tell them about how the second and third hand smoke impacts family, their children, how it might impact, again, their wallet, like all of those different things, that education, right? And understanding. And they're like, I do want to quit. Like something in them kind of opens up and says, well, I have, but I've tried, but I've never been able to. And so then, right, when they go to the 1-800 quit now, they'll ask them, well, how many quit attempts have you had? Never quit quitting. And then we just kind of are able to hand it over to the quit coaches who are experts at doing this and working with this. but assessing it is important, because if somebody's closed off, we're not saying, oh, you should definitely, this is never by force. This is all by them and their willingness to want to quit, right? And then assist in a quit attempt, and then arrange a follow-up. And for this, really, the assist in the quit attempt is really providing them the resources, tapping them into the resources so that they can actually attempt to quit again. And maybe they didn't have the structure in the past, or maybe they did call the 1-800-QUIT now, and they just felt like they needed extra additional support or somebody that they trusted to help them through that process. So again, the community health workers, you guys have a very special place in my heart, because you guys are connecting directly with the community, and the community trusts and loves you. And so that's what's important, is that you're impacting these individuals' lives, and you have the ability to connect with them in a way that perhaps others don't. And so if they're smoking and they come to you, we want to make sure that you guys have the tools and resources available so that they're successful at their quit attempt, so that they're successful at getting the resources, and so that you feel confident in providing the resources that we have that are available, and not feeling like, I don't even know what resources are available. I don't even know how to support these individuals or get them. So the online training, I feel, is really, really, really important. If you go to TUPAC's website, like I said, I'll go on there after this and show you where it's at. And it really helps you kind of go through the different techniques to support an individual if they want to quit. And then you feel like you're geared up. And also, the resources that are free, we provide those. So, we can say, here's free material if you want to give it out, and you can provide those as well. Online training modules, free continuing education. So again, we have different ones. The biggest one is the family tobacco intervention in New Mexico, treating nicotine dependence in New Mexico. Of course, the oral health setting, those are for people, dentists, and people who do oral health, and then behavioral health care settings. You definitely do all of them, but those specifically, and it's a lot of the same kind of material, but with specific focus on, behavioral health or oral health. But you can definitely, if it's something that you want to do, can definitely look at them, and you do get CEUs for them as well. And that, again, the training modules are available at nm2pac.com. So, so we also have the New Mexico Health Systems Change Training and Outreach Program. And it's to establish multidisciplinary site team and conduct a guided assessment of the site and gather a baseline. So basically what that means is that we're basically supporting individuals or clinics or hospitals to do what we call systems change. And that's really an assessment of an overall understanding of how they engage in tobacco treatment and also tobacco policy. So it's kind of looking at that two-pronged approach. It's like, what are the treatments, and do you even ask about it? And then also, does your organization itself even have a tobacco policy, and how do you engage in it yourself? And so the assessment is done, and then what they do is they do a plan, right, and improve the plan. So basically, it's a change to develop sustainability and maintain changes within the organization and with the way that they administer treatment for tobacco prevention. That's something that I'm working on right now as well. But we do have Optum who goes in and actually does a plan with these individual systems to help them get a overarching plan for change and sustainability. So really leveraging already what they've integrated into their organization, and then leveraging what's already there. So what do they have available, and then how can they add the tobacco cessation and treatment inside the system itself? And that's something we've been working with to look at. So it's just another part of, or another practice that we have within tobacco and cessation support. So if you're, I mean, this is really, if you're interested in your organization, sort of looking at the policies or how they engage in it, that's something that we do as well. And I typically will look or work with the organization specifically and go through a set of questions to kind of determine what are the recommendations necessary for the change. And then Optum can step in and say, well, here's what we're going to do to support you with that change. So it's pretty powerful because we want to make sure that we're hitting all levels from, you know, administration, because they need to be educated as well. It's not just about saying, well, the community health workers, please educate the individuals because you work with them. Well, what about the administrators? They also need to understand why it's important to have tobacco policies in the work environment. Why is it important to have tobacco treatment when we're talking to clients? And what does that even look like? How do we support them? So I think it's really, really, really important that it's not just a bottom-up approach or a top-down approach, that it's more an integrated approach and that we're hitting all angles. So even with you, when you're thinking about your organizations that you're in, we don't mind doing a presentation to those administrators if that's necessary, to talk about the significance and importance of policy, tobacco policy in the organization, and then sort of like how do they agree to what to the screening should look like when they're dealing with clients as well, or what are the questions that should be asked when we're screening clients or we're asking questions to kind of find out where they are. So again, top down, bottom up, and meet in the middle. Leading systems change program. So again, this is the systems change. We are, again, like I said, part of that as well. I do some of that work. Optum is the one who actually supports them in the transition. Online resources, as we said, you can order promotional material online. Again, we're going to be having a gathering, and we'll send out that information to you all. And we're going to be providing resources as well, so you can come pick those up. But they will send them out to you if you go online, and this is what the website looks like. You can go and you can order quick kits for individuals. You can order, you know, the quick cards, and they're really nice. And there's a whole setup that you can put up if you want to. So the promotional, there's links to cessation services. Again, resources for healthcare professionals. That is where you guys would go for your CEU training, online training. Facts and referrals. There's also one-sheeters, you know, that explain and describe maybe the illnesses, tobacco in New Mexico. And I'll kind of go through the website after this so you guys can see what's available there. Rather than just talking about it. And then New Mexico data reports. So there's reports on tobacco. There's a program overview. They also have a Facebook. So they have online media that you can like and follow. And then there's contact information as well. So there, let's just put it this way. I like to put it this way. TUPAC has done a really good job of providing all of the materials. Now, the question is, how do we link you to the materials that you need specifically for you? Because more than likely they're going to be there, they're going to be available. It doesn't matter who you're serving, that you may. So for instance, like I was telling you, we have the Smoke Free at Home program, works specifically with individuals in apartments, complexes, or if you're working with youth, we have specific tools for youth. We have the Are You Doing Enough campaign as part of that. We also have trainings on how to engage individuals who want to quit smoking. We have it in Spanish and English. We have materials that you can provide and support. So we have links to other national resources and national data. So, I mean, it has everything is available there. It's just tapping you into what is going to support you as you're working out in the community with individuals, and then also so that you feel confident in handing out these materials without feeling like you're just like, here's the information, but I really don't know. No, we're going to tell you what's going on, how it's impacting the community, how it's impacting the children, how it's the marketing, how it's impacting their health, how it's impacting their wallet, how it's impacting just a robust of things, right? Everything is there, like I said. So I'm going to go to the website. Order your promotional kits online. So it's showing you, I guess it'll automatically take me there. I didn't realize that. And I hope you guys can see. Can you thumbs up if you're seeing my website? I don't know if I have to reshare. Can somebody give me a thumbs up? Let me know if this is showing. Okay, thank you, Mary. Appreciate that. Okay, so here we go. These are the different, the Quit Now promotional materials that you can order. And you can see, again, no cost, but we have the Spanish, we have the English cards. We have magnets. I didn't realize they had magnets now. I guess it's been a while, but they also have the stands where you can put it. So you can go on here. They have posters if you wanted to put posters up. So you can do that. They also have the online training modules. So these, again, with the CEUs, right, addressing tobacco use and oral health, these were the different ones that we were talking about. So healthcare professionals who enroll in this course will gain knowledge and skills to address tobacco use with patients, including, and then they have the consequences, risks and consequences of tobacco use, how to deliver tobacco intervention in less than 3 minutes, right? Effective communication techniques, as they said before, and then how to make the referral. And that's the big thing. We're not saying that you have to be the expert at helping a person, be off tobacco or what that looks like. It's more of saying, oh, you're smoking. Okay, is this something that you want to quit? Okay, cool. And then you go through this sort of short little model, like they said, in 3 minutes. And then you say, okay, I'm going to refer you off to this individual. And I would say, and it's totally up to you, call the 1-800-QUIT NOW if you want to. That could be something that you do. You call the 1-800-QUIT NOW and kind of ask them questions so that you feel confident about, serving them. We also, another thing just to keep in mind, and maybe it's something that we can do in the future, is to have, a training or a presentation of the individuals who actually a coach or the person who runs this 1-800-QUIT NOW come and answer questions so that you understand exactly what the individual is getting when they call in. And so that you feel confident in referring those individuals. It will go over it here, but sometimes it's better to be able to talk to someone live and come with questions. That's something we can do. If you guys are interested, let me know. So family and tobacco intervention for healthcare providers again. So this is quitting with families and understanding how to work with families, which is really important. Again, the children, okay, and how to deliver the tobacco intervention in less than 3 minutes. Again, the communication and the referral. So you can see that it's pretty much the same, but there's a little twist on in the differences. One is the risks and consequences. The other one is the use and benefits for quitting for the family. So they're going to kind of go over, well, why is it important to the family? And part of it is because of the impacts of second and third hand smoke on children, and also the financial, right, part of it. Like, how is it, taking away from, again, their productivity perhaps, or days sick or missed in work. So how does it impact the family, consequences in the oral health and the behavioral health setting as well? And this is kind of unique and something you might be interested in, is the behavioral health treatment part as well, because you are working with behavioral health in some ways. And they have just another way to do it. There's data, again, that you can look at. So the data will provide information. And then if you need to do it in Spanish, again, you can do this in Spanish. There's this button here as well. But again, we have like the trends in New Mexico, youth trends in New Mexico and tobacco use. We even have middle school tobacco data. And again, they start when they're young. So it's it's eye-opening for when you start to read this. They have some,
Natalie,
yes.
Can you stop your share? We're still seeing the PowerPoint. We're not seeing the website.
Oh, you're not.
Mm-mm.
I thought someone had thumbed it up. Did they not see it at all?
I
No?
think what it looked like it was the site, but it wasn't.
Okay. Okay, we're going to go through this again. I do apologize. So I won't go through all of what I said before, but we have the online training modules. And so you click on here and the online training modules, let's see if it'll pull it up now. Yeah, it's thinking. And then the data, that's where I was with the data, but here we go. This is where you click for the different resources for the online training modules. And then you click to get started, and then you'll get your CEUs after. Then we have the data, and then the quit promotional materials here. Again, they have secondhand smoke, the e-cigarette, vaping. So these are the different promotional materials that you can order. You just add to cart and ship it off. It's pretty awesome. It's like Amazon shopping without having to pay anything. That could be fun for people to, to go online and say, well, I pretend that I shop today. I have to pay nothing. Okay, and then we have the e-cigarettes and vaping. So again, if you go to the website, and I'm going to put this on, let's see here. So we have a Stream Vape documentary. Again, a ton of resources. Everything is here. So there's really no need to invent the wheel. Like we already reinvent the wheel. We already have everything here. We just want to make sure that you guys are able to utilize the resource and effectively so that you're not kind of like, well, I don't know exactly where to go or what's available. Secondhand smoke, this is really powerful. We also have the Are You Doing Enough? Because some of you might have attended the Are You Doing Enough campaign. But Are You Doing Enough? Right? Smoke-free homes and cars, multi-unit housing, your the Clean Indoor Air Act, and then secondhand smoke protections for Native American. So we also have that. If you're working with tribal communities, we have information for that as well. On commercial tobacco. So again, tons of resources available to you. And then let me stop share. And let me reshare my screen. Share. Okay. Oops. There we go. So again, we went through that, the English and Spanish and fast delivery, and again, fast delivery for it. So we've gone through the website and talked about the statistics. As you know, I think the biggest thing that I want to close this out with is, well, first of all, thank you for showing up. It's always important, especially to me, because I always talk about my story and how I ended up in tobacco nicotine prevention. I didn't think that this is what I would be doing, but I was exposed to it as a child, and I had ear infections. I used to get strep throat quite a bit. I had respiratory issues, asthma, and that impact, and I had no voice to be able to communicate the impacts that it had on me. And so my motive for doing it is to support the families and the children, and to grow from there into supporting individuals to understand that they were specifically targeted to be smokers. And so really having that connection to the community and talking to them and saying, hey, this is why you're impacted by it. This is what happened. This is the story. And reminding them that they were targeted specifically by the tobacco companies, and that it's impacted their life through chronic illness, and it's possibly potentially impacting their family because of their choice, but it's preventable. We can prevent premature death. We can prevent death if we stop and reverse that cycle. And so again, it comes from the education, really just educating individuals And however I can support, if you guys have any meetings or anything like that, and you're like, well, you know, presentation, stuff like that, we can work and look at supporting and speaking to, you know, even if it's your employers and that kind of stuff, or if it's a family that you're working with, whatever it is, we can support. That's what we want to do. We're here as a support. So I want you guys to feel like we're a resource and we're here for you. You know, we're here to serve you and support the families as well. So I'll just end by saying thank you so much for showing up. The CEUs, I think you have to go on to, I don't remember the name of it, Krista. What is it, Weaver? I don't know. I'm making names up. I apologize.
Huva.
What is it, Uva?
It's Huva.
Huva, Weaver. I'm calling it Weaver. So if you go on to Huva and you fill out, there's going to be a questionnaire you could fill out, and then it'll be mailed to you for your CEUs and your certificate as well. I think we might have some questions. I haven't looked at the chat. Let's see what it says. So I apologize. Can we get a copy of the PowerPoint? That's a great question, Mary. Let me find out from the Department of Health if this is something we can share. Never. Suzanne already answered it. Thank you, Suzanne. Thank you. These are great statistics. Oh, okay. Let's see. Awesome. Well, thank you. I didn't realize Suzanne had done that for me. I appreciate it, Suzanne. So if you do have any other questions, comments, or concerns, you can email. There's going to be an email going out, and you guys can respond and send me any questions you might have that I didn't answer. I will be putting you guys on an email where we're going to be in June having again at the park. You can come down Baton Memorial Park, I believe, and I don't remember the exact date, but you can come down and get resources if you need them, and to come say hi. And one last thing, we will be opening it up for people to join what we call our core group of individuals, where we're working with specifically Bernalillo County as to kind of look at how to support people experiencing poverty. How do we administer resources, provide resources for the population, and support them in their cessation and tobacco treatment. So we're really looking at that, and then how to support the individuals who are serving that community as well. You guys are welcome to be a part of that core group. We will send out an email if you're interested in learning more. Again, it's going to be a year of provided CEUs and perhaps other incentives as well to keep you engaged, and then resources. So if you guys are interested in that, we will have more information on that when we are at the park, and you can come take a look at what we're doing. If you're interested right away, if you're like, I'm just so excited about tobacco prevention, I want to know how I can get involved, please email me and I can send you the letter of intent that kind of shows the different stages of that you can get involved with the core group. And again, it's working with the Bernalillo County. So there you go. Anything else? Is there any other questions, comments, concerns? Take a look. Thank you, Krista. That is my email if you want to take it down, and you can email me and I will get back to you. If there are no further questions, thank you for support. Yes, saving lives. So here we go. This is the last. Thank you for partnering with us to make the most of the life-saving opportunity. Ask the question, providing trusted advice and making referrals will save the lives and reduce exposure to secondhand smoke in families. Your involvement will help clients for sure know about free cessation services for themselves and family members. So again, we appreciate you more than you know, and we're very, 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 very excited to have you on board and to be providing CEUs and support for the community as well. And we will get this slide out. I guess Suzanne said we can do that. So if you guys are interested, we'll do that as well. So we will close this out. Looks like we have, you get about 15 minutes of your time back, which is amazing, right? It's always good. So you guys have a great day, and I will be seeing you next time.